next few minutes, I'd like to introduce you to the VenaFlow Elite mechanical DVT prophylaxis system manufactured in the United States by DJO Global Aircast Division. In the United States, more than 200,000 people die annually from a combination of DVT, deep vein thrombosis, and PE, pulmonary embolism. Many of these deaths could be averted by the use of proper mechanical prophylaxis. So I'd like to just start with our unit and tell you a few things about the design rationale and what makes it totally unique from all others on the market. Let's start with the cuffs. This is our standard size cuff. It is made of a soft, breathable brushed nylon material, which therefore makes it cool and comfortable to the patient, because comfort equals compliance. So it's very important for the patient to be comfortable as well as having a properly fitting cuff. This cuff will fit a calf circumference up to 19 inches. 19 inches equates to around 300 to 350 pounds. We have an extra large cuff next, 22 inches in circumference, that equates from 300 to 500 pounds. Then lastly, we have a bariatric cuff, 30 inches in circumference, 500 plus pounds. The the VenaFlow Elite system will also run foot and thigh length garments. The one pump will run all three garments without compromise or without having to press a separate button for selection. Now, I mentioned that this standard size cuff will fit a patient up to 300, 350 pounds. You may ask yourself, what about the small patient? Suppose you have a small grandmother, maybe 85 pounds. Well, it's very simple. You can use the standard size cuff. You can take scissors and trim to fit, or more simply, you can just fold the material back on itself, making it a smaller garment. So therefore, this allows you to cut down on the inventory, the SKUs for your hospital and or surgery center. Now, a lot of thought has gone into the design rationale behind the VenaFlow Elite. Let's start with how it is different from everything else on the market. All other pumps on the market have an inflation rate of around 11 seconds. So they gradually fill the garments, 1001, 1002, so on to 1011. So in essence, they're gradually milking the blood back to the heart. VenaFlow Elite's inflation rate is 1 second. The VenaFlow Elite has 2 air chambers, therefore it makes it graduated sequential. The air chambers overlap. This is distal, this is proximal. The distal fills first, and then 3/10 of a second later, the proximal fills. The distal fills with more pressure than the proximal, so it starts an immediate wave-like action of forcing the blood back to the heart at a higher venous velocity. This is the differentiating factor between us and everyone else on the market. As you increase this venous velocity and start forcing the blood back in a rapid fashion, it causes the vessel to dilate slightly. When you have vasodilation, shear stress is created on the endothelial walls, the intervessel walls. And as this shear stress is created, the body releases nitric oxide into the bloodstream. Nitric oxide is a known clot inhibitor, and in actuality it's somewhat of a lubricant in that it lubricates the vessel walls to prevent the individual blood cells from clinging to the walls to start the clotting cascade from the start. Furthermore, in each vein is a valve that opens and closes every time the heart beats. Behind these valve cusps is where clots generally start to form. The added benefit of the VenaFlow Elite with the rapid inflation, or normal inflation as we like to call it, it creates turbulence behind those valve cusps and keeps the stagnant blood, or venous stasis, washed away. In my opinion, this is the differentiating factor, in that with the release of nitric oxide caused only by rapid inflation and vasodilation, no other pump on the market can make this claim, because with slow inflation you can't have this. This is what makes us unique. I want to take you back to your childhood now so that we can all understand a little more about vasodilation and the differences between our pump and others. We all as children, regardless of where we grew up, pretended during the summer months the garden hose was lying across the yard. We became tightrope walkers. We were walking heel to toe on this garden hose, which was in actuality our tightrope, 100 feet above the air, and surely if we fell, our days were over. Well, as you walked heel to toe, very gently and slowly, 1001, 1002, 1003, you were emulating the other pump's inflation cycle. Well, we all had a big brother that liked to pick on the younger siblings who would run through and try to knock you off of your perch, off of your tight wire, 100 feet up, but more so he would jump on the hose. As his weight hit the hose rapidly, what happened to the water in the hose? It squirted out, whereas when you were doing the very slow heel-to-toe walk, it was trickling. This is a good example of how the VenaFlow Elite works. It collapses the vein in an elliptical fashion in a very rapid sense. So therefore, that's where you get your vasodilation, your increase in venous velocity. Now, there was a study done at the University of North Carolina, the only head-to-head comparison, comparing our product, the VenaFlow Elite, and its rapid, quote, normal inflation, to the market leader, who is a slow fill system. Well, the bottom line, at the end of this study, and this was a 5-year prospective randomized study completed on total knee patients. And as you know, total knee and total hip patients generally have the highest rate of DVT. Well, the results of the study was the patients that had our system over the competitor system, the slow fill, had a 52% reduction in the rate of DVT. We can only attribute this to the rapid or normal inflation. This inflation cycle most accurately mimics your body's natural pumping action of when you walk. When you have a surgery and they get you back into recovery, what's the first thing they ask you to do, or try to get you to do as quickly as possible? Walk. So therefore, the VenaFlow Elite mimics the body's natural pumping, the walking mechanism from the firing of the muscles in the calf. So this makes it really unique, and no one else has anything like this. Now let's go over the pump briefly. We have a lot of unique features with our pump that the others do not, that are very important. Starting with our bed hanger. As you can see how easily it's extracted. It will fit all the beds in the hospital, because as you know, hospitals replace beds on an annual basis, but they don't get rid of all of them. They'll keep some of their newer beds, get rid of the oldest. So therefore, in most hospitals, they may have 4 or 5 different styles and brands of beds. Well, having a pump that will hang on the bed is a problem for all hospitals. So the design rationale was great in this expanding bed hanger. It has little teeth under here that ratchets when it closes. You may can hear them click, but it will allow it to pinch down on all of the beds, including the newer beds have the control panel at the foot that flips up, and it has the controls underneath that. And then it angles off at a slight angle. This will even pinch down and hold on those sloping surfaces, which is truly unique. The controls of the VenaFlow Elite are very simple. The green button is your on and off button. It also serves as an alarm reset. You have a button on this side that shows a single and dual leg. So if you have a single leg application, you merely press the button. It determines which leg has the calf cuff on it, or the foot, or the thigh, and it shuts off the airflow to the other side. It allows you to use only one cuff. This is your timer reset button. When you first turn it on, it always starts a timer, and then this is used for patient compliance. So say if you have a hospital runs 3 shifts a day. When shift A is finishing up and they're making the rounds with the second shift coming on, the charge nurse can merely log in, or chart the time that the patient had worn the device during her shift. And then they can press the reset button, it goes back to 0, so the second shift can start timing their time, and the third shift the same. Okay, suppose during a 8-hour shift, a patient showed 6.5 hours. And they may question, well, you know, I had control of the patient for 8 hours. What happened to the other time? Well, you think back, physical therapy came in, they got the patient up, walking, did their physical therapy, so they were gone for an hour there. There's another half an hour to be accounted for. The patient got up and went to the restroom 3 times, you know, at 10 minutes each. So therefore, it makes accountability very easy for the nurses. The VenaFlow Elite weighs 4 pounds. We have a battery option that adds another ½ pound to it, so it's 4.5 pounds, which is still very light. When comparisons come into play, I say it weighs about as much as a gallon of milk, because everyone is familiar with that. Our tubing length, we have 3 lengths. Actually 4 lengths. We have 5.5, 8.5, 10.5, and 12.5 lengths. And this is very important because the 5.5 is most commonly used on the floors. 8.5 in ICU, PACU. Sometimes they'll have some additional equipment that they may need a little longer tubing. For the ORs, we suggest the 10.5 or 12.5 length. The 10.5 or 12.5 because if you're doing a total hip case, for example, the doctor may need to raise the level of the fracture table, maybe to chest height on him. So thus you may need the additional tubing length to accommodate. Our electrical cord is 14.5 feet. It has a standard hospital connector, and then some other features about the pump is the connectors themselves are your standard Kohler style connectors. They merely snap into place. There is no right, no left. It is simple click and go. This is the basics of our VenaFlow Elite system. We would love for you to consider using it for your patients, and I will be around a little longer. If anyone has any further questions, I would love to answer them. Thank you once again for your consideration of VenaFlow Elite.